The primary care track is a track that was developed for pediatric residents with a focus on outpatient medicine. The learning objectives for the track are very individualized. So the very first thing we do when you start the track is we meet together and we go over what are your strengths, what are your weaknesses, and then we base the electives that you're going to be choosing based on that, and we just kind of come up with a team together. So it's very flexible and it's meant to be that way. The primary care track is different than some of the other tracks because it's got some really cool electives. One of the electives that we have is called Transition to Practice. Transition to Practice is an elective that you do for 2 to 4 weeks depending on what you want. And it focuses on clinics on an everyday basis, but it's more than that. You also meet with a financial planner, you learn how to bill, you learn the ins and outs of managing a practice, and so residents really love to do it. The other elective that we offer through the primary care track is a private practice elective. So with UF, you do most of your outpatient settings in an academic setting. You'll have very different patients, but they're all sort of academic. What this elective allows you to do is to go into the private practice, go into the community, go into the rural areas, and find out how to practice medicine that way. Lastly, for residents who are in this track, some of them just need different experiences, and so they might want to do more emergency medicine or more newborn nursery, more pediatric after hours, and so they have a lot of flexibility in choosing what they do with that. One of the things we do require is that every resident do a case report so that you kind of learn the ins and outs of doing them, so that if you want to go into academics, and publishing is a very important part of that, you're going to be ready to do it. While we start the track intern year, most of the focus is going to be on late second year and late third year once you have the basics under your belt. So my role, which I share with Dr. Molly Poza, is to be the primary care track residents' mentors. We put that as our top emphasis. We want you to graduate residency feeling competent and confident, and sometimes it's really hard when you get out there and make decisions on your own for the first time. So when you graduate the primary care track, we want you to be out there and just say, like, I've got this, and so we do most of our focusing in on that.